Officials in Toronto have confirmed 2 people in the city have West Nile virus, while officials in Halton, Ontario are investigating one possible case. West Nile virus is transmitted to people through mosquito bites. Toronto Public Health says as of August 18th, 47 positive batches of mosquitoes were identified as positive for the virus. Public health officials are reminding residents to cover skin with clothing and bug repellent when outside between dusk and dawn. Also in Ontario, Cambridge Memorial Hospital, just east of Kitchener, is declaring a COVID-19 outbreak in its inpatient surgery unit. The hospital says the outbreak is limited to a patient and a hospital staff member. And let's now bring in Dr. Isaac Bogoch, infectious disease specialist. Dr. Bogoch, good afternoon. Great to see you. It's been a while.
Great to see you as well, Akshay.
Okay, let's discuss these two stories we're tracking this afternoon, Doctor. One, of course, the West Nile virus and then COVID-19. So speaking of the West Nile virus first, how concerned are you about the situation at the moment?
Not really. I mean, it's important to recognize that we see West Nile virus every year at about this time. It's usually a typical late summer, early fall infection. As the report pointed out, it's transmitted primarily by mosquitoes. They like to bite at dusk, at dawn, and in the evening in between. And it's pretty straightforward. We know how to protect ourselves from mosquito bites. You can wear longer clothing. Obviously, you can put on mosquito repellents as well. And this year there might be more West Nile because of the weather we've had, and in certain parts of Canada, not all, but in some parts of Canada, there's just better breeding grounds for mosquitoes. So we might see more West Nile in certain places, for example, in the greater Toronto area. But in general, the vast majority of cases are mild. It should be noted, though, there are rare but real severe infections. They are rare, but there can be severe neurologic manifestations from this infection.
Okay, I just wanted to know, Doctor, what does it mean when they say that as of August 18th, 47 positive batches of mosquitoes were identified as positive for the virus? What does that mean, 47 positive batches?
Right. So behind the scenes, there's a lot of surveillance for infectious diseases in natural habitats, including in mosquitoes. And they're screening mosquitoes for viruses such as West Nile. There's tick screening around much of the country as well to see what the prevalence of Lyme and other infections are. And this is ongoing throughout the insect biting season to really determine what's out there and what might impact human populations. And of course, if someone gets bit by a mosquito and does get West Nile, this, of course, can be recorded in a healthcare setting. And most of the time, we would report a lot of these infections as well to the public health authorities so that they would know that this is around, so that people can be informed of that, a virus like this is circulating and they can take steps to protect themselves.
A quick check, Doctor. What are the early symptoms that people need to watch out for where West Nile is concerned?
The vast majority of people are actually asymptomatic or have mild symptoms. Those symptoms typically are fever, sometimes a headache, sometimes muscle aches and pains, very non-specific, but that's the typical illness. And it can happen anywhere from 2 to 6 days after being bitten by a mosquito that's infected with West Nile. And the vast majority of people won't even come to medical care. Most people won't be sick enough to seek medical attention. You take some acetaminophen and you recover in the comfort of your own home. Rarely people get sick enough where they come into hospital. There's a total selection bias. They might have more severe manifestations, more severe headache, more severe fever, and some of the neurologic manifestations. That's where most of the diagnoses are made. But I think we're just only seeing the tip of the iceberg of the severe cases that come in.